As of September 2013, more than 12 million people in the United States have been diagnosed with COPD, but the total number of people affected, including those undiagnosed and likely to have the disease, is estimated at 24 million. The term COPD actually covers two main conditions, chronic bronchitis and emphysema, which limit airflow and causes breathing difficulties. A person with COPD may have chronic bronchitis or emphysema, or both. Understanding how the lungs function is helpful in understanding COPD and how it affects you. When you inhale, the air travels down your trachea or windpipe into tubes in your lungs called bronchial tubes or airways. These tubes branch out like a tree inside your lungs into thousands of smaller tubes called bronchioles. At the end of each tube are small round air sacs called alveoli. In healthy lungs, the airways and alveoli are elastic or stretchy. This elasticity helps the lung keep its normal shape and move the air in and out effectively. When you breathe in, each alveolus fills up with air like a small balloon, and oxygen travels from the alveoli to your blood to be used in your body. Normally, when you breathe out, the alveoli deflate and carbon dioxide is cleared out of your body. As discussed previously, emphysema is one of the main lung diseases included in the diagnosis of COPD. Emphysema is seen when the walls between many of the alveoli in the lungs become damaged and floppy, and they no longer contract back to their original shape. These damaged alveoli can prevent the passage of oxygen from the lungs into the blood. The walls of some of the alveoli can also be destroyed, leading to fewer and larger alveoli, decreasing the total amount of air moving in and out of the lungs. Because some air cannot move out, it may stay trapped in the lungs, keeping you from exhaling fully. As we discussed, not being able to breathe out fully keeps carbon dioxide in the lungs instead of clearing it out. As a result, patients with COPD can have higher levels of carbon dioxide trapped in their lungs compared with healthy adults. With chronic bronchitis, the other main lung condition included in COPD, the lining of the airways or bronchioles is continually irritated and inflamed. The term bronchitis means inflammation of the airways, including the bronchioles. That inflammation causes production of large amounts of thick sputum or mucus, which clogs your airways, making it harder for you to breathe. COPD usually starts because of long-term exposure to lung irritants such as smoking or secondhand smoke, certain chemical fumes, dust, or air pollution. This type of irritation causes a chronic inflammation and production of thick mucus within the tubes that bring air to your lungs. This results in a narrowing of the space inside the airways, making it harder for you to breathe in and out. Your chest may feel tight, you may have a chronic cough with or without mucus production, and you may start wheezing. You may also start to feel shortness of breath when performing your regular daily activities. The inflammation also prevents your lungs from getting rid of new irritants, so you may start coughing more often and may cough up mucus as well. COPD symptoms can vary in severity and typically worsen as the disease progresses. You may or may not be experiencing some of the symptoms I described earlier. The severity of your symptoms will depend on how much lung damage you have. Mild COPD symptoms, such as shortness of breath, may be handled with simple lifestyle changes, such as taking the elevator instead of the stairs. However, COPD that is more severe or has progressed can cause symptoms such as swelling in your ankles, feet, or legs, and weight loss. Some severe symptoms, such as having a hard time catching your breath, blue or gray lips or fingernails, a fast heartbeat, or a noticeable lack of mental alertness, may require treatment in a hospital. We will continue to assess how your treatment is working to alleviate your symptoms and determine if it needs to change over time. Although the damage to your lungs from COPD cannot be reversed, available treatments and lifestyle changes may help improve some of your symptoms and minimize further damage.